Okay. So the way I have this broken up is kind of trying to kind of do 3 equal components of those main topics. And for those of you who are not aware, many people submitted questions preemptively, and I'll go ahead and get started with some of those. But if that sparks other questions that you all have, please feel free to put them in the chat, and we'll kind of incorporate those. Other panelists, if you want to answer the questions in the chat, if you feel like they're, something that you could easily answer in the chat, you're welcome to do that as well. We'll kind of just tag team and see where we go with this. So the first question, or first area I was going to kind of start us off with was talking about personal statements. So one of the first questions that somebody posed was, when you're looking at personal statements, could they be similar to like the personal statements that you use for your away rotations? So when you applied for those away rotations, what are maybe the differences and the similarities, or how did you guys, I don't know if any of the residents have thoughts on how you guys navigated that scenario. Would love to hear it.
Yeah, I could quickly, share some thoughts. So I think you definitely want clear differences between your away rotation personal statement and the personal statement you ultimately send towards residency, because they are trying to get you to reflect aspects about yourself in different phases of your life. An away rotation is very specific to a program and very specific to a region. And so you want to really portray a couple elements as to why you want to rotate there specifically. Whereas I think a, PM&R personal statement into residency is more about what attracted you about the field, what do you think you can add, and why do you think you're a good fit for this general field of PM&R? And I think you have to approach that from a much wider scope. And in that, maybe include a couple more aspects of your personal life that can really shape a story about yourself. Because I think in the general personal statement, you're more looked at sort of as a general applicant, whereas in an away rotation, it's why should we, let you, come here and give you an opportunity to come here? Do you have something specifically attracting you to our program or our region?
I'll just add, I echo Dr. Singh's advice, and I know many of you may have not even, applied for away rotations or had that opportunity, and some programs don't even require letters, so maybe this particular question does not apply to you, which is completely reasonable as well. But certainly focusing towards your attributes that would be a good candidate from a residency training perspective, I think that's good advice.
And that probably leads us really nicely into sort of one of the next questions, and maybe we expand on some of the thoughts that you guys had via that first one. But what are program directors typically looking for in a personal statement, or what are the people that are reviewing that first pass? What are you looking for? Or for the residents, if you're not one reviewing the applications, what did people tell you that people were looking for? I can answer questions too as the second faculty. I don't want to put it all into Dr. Romanoski, but.
Yeah, I can take a step. I review, so I'm part of the committee that reviews the visiting students in addition to for like actual residency interviews. So part of the thing that I look for specifically that mostly stands out to me for residents is that there's something PM&R specific that you've been engaged with. So a lot of people have community engagement, research, or whatever the case is. If it's like related to rehab or a disability, that's something that typically catches my eye to say, hey, this person has some level of early experience with the field and can, maybe kind of shape and guide how it looks in the future.
Yeah, and I'll just add one piece of advice that I got that I think kind of can demonstrate like your fund of knowledge of PM&R is just talking about like varied experiences you've had within the field and kind of showing that more than just, let's say, sports medicine or spinal cord injury. Like, show that you can kind of have a good understanding of the field as a whole. It's very broad. You know, you can go into so many different areas within PM&R. And, you know, I remember that I talked about, like, I had volunteered at a muscular dystrophy summer camp. And so kind of like the neuromuscular aspect of PM&R. I rotated at like a movement disorder clinic, and there were some rehab doctors there. So, you know, even though these things are kind of niche, I think it just really goes to show that you spent some time really like thinking deeply about this field, and you understand kind of the breadth that it entails.
And of course, every program director would probably answer this question differently, which I think is the beauty of a personal statement, right? It's personal to you. So that's what we're looking for. I think I'm looking for a story. It doesn't have to be an elaborate story. But someday in the future, your patients will ask you, you know, why did you go into physiatry? And so that's what I'm looking for. And you may still be putting those feelings together of why. So I just encourage you to just reflect on that. And I think the other thing is potential, right? So we don't expect applicants to come into residency completely ready to be a physiatrist. That's what training's for. And so looking for future potential, and that's difficult to put into words, but think about, you know, your past experiences. They can be successes, they can be difficult times. You know, what are your past experiences, and what sort of potential do you have for the future in your training is something else you can consider.
Perfect. What do you guys think? Should any special circumstances, such as like a leave of absence or, you know, poor grades or, you know, any of those kind of things we denote as red flags, should that be addressed in your personal statement? Or how do you kind of, you know, specifically the question was, if you had any health issues that led to a leave of absence, would that change the way you address it? Would that be something you put in your personal statement, or like kind of, what do you typically advise students, or what are your thoughts on where that goes in your application?
I mean, when I was looking through applications this past year, you know, it's my only year doing it. I'm not a program director or on the board. So I will say I really enjoyed reading the personal statements where people painted a story and they really kind of painted a picture of themselves in their story. I think if there are circumstances like a leave of absence or some sort of, you know, significant event that helped shape your story, then I think it's great to add it there. But otherwise, I felt that, and there weren't too many personal statements like that, but when people would just bring up circumstances that felt a little bit out of the cohesiveness of the personal statement itself, it didn't really flow as well. So I think if it contributes to your character building and your journey to becoming a physiatrist and applying towards it, then I would say thoughtfully add it in. That would be my best advice for that.
Hi, everyone. I'm Nikola Dragojlovic with UC Houston PM&R. As a program director, I will chime in and add something similar. You know, I would say that if there are times in your medical training that you had to remediate clerkships, or you had to take time off to prepare for a licensing exam, or you had a health issue or a family matter that delayed your training, I do think you should address it and be prepared to answer questions about it. It's not necessarily coming from a negative place, like explain yourself. It's coming more from a place of understanding, you know, how you responded to that circumstance, because it's inevitable during residency or at some point in your future career as a physician that you're going to face some type of adversity, whether that's personal, family, relationships, whatever it may be. And program directors want to see that you have the emotional intelligence and maturity to handle those situations. So whether you discuss it in your personal statement in a thoughtful way, like what previously mentioned, which I think is fantastic. It's also something that you could address in the impactful experiences section of EREX, right? Not everyone's going to have an impactful experience, but that would be a place where you could comment on that and provide some additional context that could be missing from your team's letter.
Yeah, I think from my standpoint, you definitely want to address it. You know, I think we don't know if we don't read it. And I think, you know, the assumption, we read hundreds of these a year. And so like, if we can't pretty quickly figure it out, then it often is like put into the pile of do not invite or, whatever they do it. So I think erring on the side of caution and disclosing somewhere, I don't think it matters really where. I think that probably goes under the Dr. Singh's advice. If it seems to flow in the personal statement, that's a fine place to put it. But if it seems a little out of place, like impactful experiences would be totally fine to do it. But I wouldn't leave it up for interpretation, because I think we have too many applications to review, and I think a lot of us won't take the time, honestly. Okay. Are there common things, next question. So are there common things that students do wrong, or maybe you would advise students not to do when it comes to the personal statement? Like, what are some common faux pas, or however we want to phrase that, when you're reading personal statements?
I would definitely suggest, keeping grammar and prose as professional as possible, because I think, you're all smart and you're all probably great writers, but you want to be careful to not toe the line, too much into creative and expressive writing, where it becomes a little bit hard to sense as, professionalism in that. So, you want to make sure everything's grammatically correct and, written in a very professional way.
I think it's a good idea to have people outside of medicine read your personal statement and have them review and reflect on, how do they interpret, or, how does your story from the personal statement come across, right? Sometimes you get so caught up in looking at your own personal statement 40, 50, 60 times over, you get to that point where like you have writer's block and you lose your creativity. And sometimes it takes an outsider's perspective to help you get a fresh set of eyes and reinterpret what you've written. And I wouldn't necessarily do this from family members, but maybe a friend who's in a different field altogether, right? Somebody outside of medicine, or a mentor from outside of medicine, maybe somebody that you knew from like college or high school or something, right? These are all ways to get different sets of eyes on your personal statement and see how it reads, and they can give you some insight on whether you're conveying what you intend to convey and how it all ties together or not.
I just want to highlight that comment from Dr. Dragojlovic. That was such a good idea, to find people who maybe don't know you intimately. I think most of us would agree. It's not uncommon to have the question of, well, what is a physiatrist, or what does that mean, or what are you doing? So have somebody read it that doesn't know, and maybe have them ask them, okay, so what do you think I'm going for here, right? What sort of message am I sending? Somebody that's not a physiatrist, maybe somebody that's not a mentor, that requires a little more vulnerability. So maybe an old friend or a family member, somebody who's external to what you're doing right now. I think it's a great idea.
Perfect. There was kind of reflecting back on the previous statement, there was kind of a follow-up question that came through the chat. What is your opinion regarding including a personal disability in a personal statement, and if that could be potentially counted against an applicant? I can tell you, so I have a resident, and I think she'd be okay with me sharing a little bit of her story without too many identifying information, but she was a student of mine. She's now in my program, but she kind of went through this a lot and had asked a lot of people, not necessarily a quote unquote disability, but a medical condition that could definitely impact her training at various times. And the way I advised her was, that shouldn't happen because you have laws protecting you against discrimination for that kind of stuff. But honestly, if it does, do you really want to go to that program? I think, we're a field that like embraces disability and embraces different ways of doing things. And so I think like, if you truly have a program that's not going to embrace you for something that you are, like, you probably don't want to be there. And that's kind of the advice I had given her. don't know if anybody has any other thoughts on that.
Yeah, I think that that's good advice, Dr. Bolger. I would also say, how everyone views their whichever disability they have in the context of their medical education or their inclination towards physiatry could be very different, right? And we don't want to assume that anyone's physical or other disability is directly tied to their desire to be in physiatry. And so like we've alluded to earlier, if it's something that ties into your story, mention it, right? I think that if it's something that is a part of who you are, but isn't necessarily related to your interest in physiatry, you don't have to put it out there, right? If there's some accommodations that you need, or special considerations that are related to your disability, those are probably better things to talk about with like program coordinators and program directors offline, outside of your personal statement, right? To better understand how programs can accommodate whatever your needs are. It's not something that
Fantastic. Does anybody have any other questions related to the personal statement, kind of as a transition point to go to the other two topics we were going to allude to tonight? Any questions from the audience, either in the chat or you can unmute?
Yes, I want to talk very quickly. I'm debating between talking about this story that brought me to the profession, or talking about my characteristics with specific experiences. Like, I have so much to tell about, and yeah, how it can be more interesting for you.
I would say whatever you do, try to keep it simple, right? Because you want to be able to use these events or these stories as a framework, right, throughout the entire personal statement. If you spend a lot of time describing everything that happened, you lose out on the opportunity to describe the growth and maturation process that comes out of that, and how that led you to physiatry in some way. So whenever you're using like personal anecdotes or personal stories, I would try to limit it to like, 1, 2 tops, because otherwise your personal statement starts becoming very convoluted and busy, and then it becomes increasingly difficult to tie everything together into a cohesive form.
I would agree with that. There's other places to highlight some of the rest of your story as well. So the experiences, for example, and I think some of you may feel that it's difficult to fill your experiences, and I know we'll get to that section shortly. And some of you may feel that you have so many experiences to share. Some of those you might want to save for the interview anyway. You don't want to just regurgitate what's already on your CV. Program directors do a really great job of holistic review, which is reviewing the entire application. The personal statement, of course, is one big piece of it. So I think through what highlights your skill set or your future potential, even though there may be so many other things that might have brought you to the field. Try to narrow that down so that you can specifically talk about those topics without diluting it too much.
Perfect. Well, that's a really nice transition to maybe our second kind of topic bucket, which is the meaningful experiences. So I think at least, Eric, you probably did some of the new application, I think, but I don't know if any of our, what our PGY 3s, were you still under the old application that had list as many as you want?
We were, but funny enough, for fellowship, it's adjusted for the new application.
Okay.
Yeah.
So the first question, and I think this is probably what a lot of students are thinking about, is any advice for how to choose which 10 experiences to include? Well, how do you even start that process?
So I can share just, for me personally, it was all about what experiences directly contributed towards my decision to make this step in this career. So for me, I went through this towards applying towards fellowship, and I thought about what made me want to hone in on that subspecialty. And still in the process right now, but when I was deciding those experiences, I was thinking about those that addressed things that I might see in that specialty, and those that also helped me become a stronger general physiatrist too. And then in some experiences, even before residency and before medical school, that were just close to me and really shaped my character. Things that I think, if you knew me as a person, you would feel that would contribute to my character overall. So maybe some things pertaining to more humanistic qualities and empathy and things of that sort. But that's my own sort of anecdotal advice. I think this is a very personal question to everyone. And I think that's what these 10 meaningful experiences are for. That's kind of the crux of the section in this application.
Yeah, I can add on that a little bit. I think mine was actually still like, as many experiences as you want. But now that, that I'm thinking about, if I had to kind of dwindle it down, I think an important, aspect of that is balance. And I know that these categories can be distinguished as leadership, research, volunteer, et cetera. And so I think if you have a nice balance, showing that you've thought about PM&R in different facets, and then also, like Dr. Singh said, they kind of shows like a more personal side of yourself or the more humanistic qualities about you. Then that can, go a long way. For example, I'm a big runner, and so I had done like the Chicago Marathon and volunteered with like a Parkinson's organization, and it was just a nice way to show, kind of my passion with running, but also, a cause that I cared about. And so I think that those 10 experiences should really, kind of focus on balance as well.
And I think, like, for me, like, balance as well as, show me who you are through your experiences. Like, if you're super passionate about something, like, that makes you you. And we're really looking to get to know you via words on paper, which is really hard when we're looking through so many of these applications. So I think, there's not one or two things that are, gonna make you like the candidate, but I would say in general, like, I enjoy longer term experiences. Like, I'd much rather see something that shows you had a commitment over a period of time. I mean, that could be a couple months or it could be a couple years. But I think that those are a little bit more meaningful for me. And then leadership opportunities, not necessarily within PM&R. It could, because we all recognize that people find PM&R at different stages of their medical school career. And so, but I think leadership qualities are something that really stands out to me. And I think as a whole, I think students applying to PM&R have more and more of those every year sometimes. And so I think, kind of focusing on, if you have any of those, I think those are probably really good ones to include as well.
And as you're reflecting and thinking about your experiences, think about things that you can talk about, that you could talk about for a potentially extended period of time on an interview. I agree with all the comments that were stated. Sometimes if you have an experience, maybe it wasn't a clinical experience. Eric, you talked about running, and that's something that's passionate to you. That's something that you're passionate about, excuse me. You can probably talk about that a whole lot more than I spent, 30 minutes doing this one thing. But on the flip side, if you volunteered at something for 1 hour and it was transformational and you can really speak to that, list it. That's great. But I think just being true to yourself, we can't hit that point home more, is really just so important. And trying to come up with experiences that speak to you. Don't try to be somebody else. Don't try to do what you think, you're hearing from any one of us here. Because once you get to that interview stage, which is what that's hopefully setting you up for, that's your opportunity to share the details about those experiences.
I'll jump in really quick. I was late. I'm sorry to miss you all at the beginning of this. In Kentucky, we practice all-star baseball for 7-year-olds this late into the day. So, but I'm Dr. Key. I'm from University of Kentucky. It's good to see all of my fellow PDs on here. But I'll just add to that. It's one of my favorite sections to read, and that's because, you know, as exam scores and all the pass-fail stuff comes up, there's not a lot of ways to set yourself apart. And so that's one of the ways that you can. But it also lets me know what type of human you are and, you know, what makes you you. And it's really one of the only ways that you can set yourself apart as, you know, what have you been through that makes you who you are? It's a way to show your resilience if you've, you know, been through something tough. But also, as the new application has come out, it's harder to show your hobbies, which used to be my favorite section. And so now you have to throw it in those areas to show what you actually love to do and share what makes you you. So definitely spend a lot of time on that when you're filling that out, and don't overlook it. Don't just repeat what your CV otherwise would say, but try to use it to show your personality. And like everybody else said, don't pretend to be someone you're not, and then you get in the interview and you're like, yeah, I have no clue what I was actually talking about, because that usually doesn't go well. Happy to be here.
Okay. When you guys are describing or reading that little blurb that goes along with the meaningful experiences, do you have any advice for the students on kind of what to describe or what things you're looking for in that little blurb?
I think this is just kind of like a side note answer to that question, but it's something that I like reading is like detail. So like numbers, for example. So let's say like you were the president or a leader within like your PM&R group, student interest group. Like how much did the group grow over that year? How many new members did you acquire? How many events did you put on? How much did you fundraise? Like I think numbers just kind of show rather than tell like how much effort that you put in or kind of some of the successes you've had. So it's like a small detail, but I think it goes a long way.
Yeah, one way you could approach it is, this is a very rudimentary way, but you could always just approach it as your role, your responsibilities, or, you know, role that you played, and then maybe a small, just like one sentence or one word about what it contributed towards your growth or what you got from it. And if you hit all three of those points in a short blurb, that'll probably you know, explain the experience well.
And with the new rollouts last year and the updated application, some of that is more standardized where you just, you know, you kind of click the category. There's like, you know, I can't remember how many little details that they offer you to put, but like more standardized in general. And I would say if that answers and gives enough information, I don't know. I don't feel strongly that you have to write anything in one of those boxes like that. You know, sometimes I wonder if we're just asking for more words. I don't know if others feel differently, but I don't think you have to write anything. Okay. Let's see here. One of the questions was having, okay, this is going to lead with a statement, but having a research job at another specialty, but pursuing PM&R, how do you explain to programs that the research job is the only job opportunity given and not interested in pursuing the specialty related to that experience? And then this individual who submitted the question said, FYI, for international grads, this may be very common. Of people.
So I will just say that's great. I don't think all of your experiences have to be 100% related to PM&R. Many of us found the field later or have other interests, and that's okay. Very similar to the comment that just came from Dr. Singh. Maybe explain what you learned from it, how it shaped you, those types of things, because there's something to be learned from everything. You will learn that in residency. There's something to learn from every patient. There's something to learn from every research experience, every job, even if it's something not medically related. So I would add that's actually a really great opportunity if it's listed in your experiences in that section to state, skill sets or different attributes that were gained from that experience.
Yeah, I love reading the applications of people who are international medical graduates. Very often they have very like serpiginous and interesting courses about how they got into medicine, how they found physiatry, and picked up a lot of different skills along the way. And I know that there's certainly a lot of people who are coming into residency training having gone straight through college, medical school, and now into residency, right? But for those of you who had gainful employment prior to your residency applications, you've built a set of people skills and maturity and emotional intelligence that you need to talk up, right? This is a huge skill set that you just don't pick up going to school, right? And so you can easily use those types of professional experiences in research. Those are like paid positions or jobs or whatnot that you may have done to amplify all of those character traits that will make you a successful physiatrist.
100% agree.
Also, another advice I got with respect to like the research portion of it is that if it's not directly related, is there an offshoot that you could bring your skill sets or prior research and make it physiatry related, like your future, like talking about future projects or future projection, or how you can make it fit to the field, because there's a lot of different types of research out there, and physiatry is a broad field, so it's definitely possible.
Okay, and then in the essence of time, I'm going to move us on to program signaling. And you guys are lucky. There's 3 of us on the call today that might know the most about program signaling of any program directors out there, because we worked the last, I don't even know how many years at this point to bring program signaling to PM&R, and are the ones that have made some of the decisions. Well, we are the ones that made the decisions surrounding it. So very timely that this group ended up on this particular road to residency section. Let's see here. Sorry, I don't know what I'm doing here. Sorry, my screens are toggling and I'm like lost my questions. Okay. So first question is, if we choose no geographic preference, do we enhance or hurt our chances at all places? Is it always better to indicate preferences even if we don't have any?
So the data would say that geographic preferences are not helpful, right? That you're actually more likely to get interviews not submitting geographic preferences than if you do. That's what the data would say, right? But your application does not exist in a vacuum, right? And different programs use geographic signals differently. It may be very important to some programs to recruit regionally, or it may be part of their funding or their mission to try to recruit people who want to stay in that area to practice. So a geographic signal in the context of that program could be extremely beneficial, right? It could also give context to someone who might seem like, why are they applying here, right? So like if you grew up in Southern California and your personal statement was all about water polo and surfing, why are you applying to the University of Minnesota, right? People will want to understand why that makes sense. And you can use a geographic signal as a way of explaining that you have like family ties to the area, or your significant other lives there and you're looking to relocate that to that area for the next 3 to 5 years. So, I wouldn't rule it out just because of what the data says when it comes to overall interview rates, because that will really exclude some people's significant personal needs.
We actually screen that out. So as part of our DE&I initiatives, we don't even look at your geographical preference. We do look at signaling, but we screen out geographical preference. Unless you just choose not to answer it, it will tell the program that you've opted in, but maybe they're not one of them. And so you either have to be all in on that question or not at all. Because once you decide to use geographical preferences, it's going to tell the other regions that, you didn't pick them. But if you just opt out completely, then it's going to say, the resident opted out, unless you have a program that screened it out and they're not looking at it.
Thanks for sharing that, Dr. Key. I think that's so important to know that programs are still using all of these metrics very differently, depending on various factors. I think the suggestion, either all in or all out is a valid one. If geography is important to you, the use of your geographic signal with geographic preference with a signal that is in that region, likely does weigh more. However, it very much will likely, again, from a data perspective, diminish your chances of receiving an interview in a region that you did not select. So you have 3 regions to select. So that's the only potential downfall. But for some of you that are, there's 3 regions and that's where you want to be, that is not a negative at all. In fact, that's a very good thing. Use those regions. But on the flip side, if regions are not important to you, I agree, you can say no preference. So either no preference or a region, it is important. But if you're going to choose regions, I would not beat yourself up too much or be disappointed if there are little to no interviews from regions that you did not select.
Yeah, absolutely. I don't want to encourage people not to use them, but if there's somewhere that you really want to be, family and life circumstances need you in a certain place, then it's probably at your benefit to use them. But we're not going to notice anyway. So.
Yeah. And I think this just, Dr. Dragojlovic had a really good point in the chat if people aren't paying attention. And I think this is like the overarching theme that we can give you some advice, but just being part of this committee and talking to lots of program directors over the last several years, every single one of us use geographic preferences and program signaling a little bit different. Like there's some general themes, and obviously we have some data to support that. But the nuances of each individual program are different. So I would agree, don't beat yourself, but do what seems like it would work best for you. If you have a preference, that's what it's supposed to be there for. I think the initial intention was to kind of have a way for those, again, to say like, I'm coming from the East Coast. I did all my schooling on the East Coast. Why on earth would I be applying to all of California programs? Because I think, we make lots of assumptions as program directors. And if we're a program that tends to not recruit well outside of our small region, then we may not want to, quote unquote, waste interviews on people that we don't think are going to ultimately want to come to us, because we all have limited spots and we're just trying to get people that want to be there. So, yeah, I don't think there's 100% right answer. So. This kind of got answered. I don't know if anybody has anything else to add to it. Is it advisable to be applying to programs that are out of your geographic preference? I think Dr. Romanoski kind of touched on this, that you're probably data shows that you are less likely to get an interview at those schools. I think you can kind of take that data, in my mind, however you would like. If you would still like to apply to programs, just know that you probably have a less of a chance. Any other thoughts or?
Yeah, one thing I just want to add in general about program signals is that everyone is asking these questions to try to figure out the strategy of how best to use your program signals. There's no one best strategy for everyone, right? The thing that you need to do as an applicant is do some soul searching and some digging around at programs and figure out, where do you most want to be? And when you've found those 8 places, those are the 8 places that you should program signal, right? What you need to understand, though, is that the program signal is going to be interpreted differently from one program to the next. You cannot control that. You cannot game that system. You cannot tilt that in your favor in any way. So all you can do is choose the programs that you want to be at and send those signals and cross your fingers and pray and hope for the best, right? It's impossible for you to know how a program is going to use the program signal to decide who to interview and not, right? And as much as you will try to glean that information from programs, they are not going to tell you because you're asking for like the secrets of the inner circle. And again, every program has something different that they're looking for. And so you'll get 50 different answers if you ask 50 different PDs. The one thing I do think is worth considering, though, is how much weight a program signal could carry depending upon what program you send it to, right? So if you're applying to programs that have like a regional bias and you send the signal to a smaller program, right, that maybe only gets like 50 signals throughout the entire application season, that could mean a very different thing to that small program compared to, maybe Shirley Ryan or Spalding, who gets a jillion program signals, right? So the weight of your program signal may be very different depending upon who you send it to, right? So that's probably the one factor I would think about apart from what programs you're going to send it to, right? You find your top 8 programs, you send it there, then think about it within the context of that, right? If like 600 other people are signaling Shirley Ryan, how much weight could that program signal realistically, right? So I would really try not to overthink it and just stick to your heart and send them off.
Mhm.
I'll give you a little
I apologize
insight.
for my I
Oh.
apologize for my children in the background. But
I mean, I'll give you a little insight though. We're a program that usually recruits pretty well, so we don't have a lot of spots. And I've used the signals more when deciding between 2 people there at the very end for who I'm bringing and who I'm not, than pulling everybody that signaled us first. So it may make or break you when you're being compared up to just a few more people for those last interview spots, to say they put in that little extra step to say they really want to be here. And I might pull you for that reason. We read every single application, so the signal itself doesn't really, spark interest early, but it may help you down the line.
And I've definitely heard other program directors have similar kind of like they use it as a quote unquote tiebreaker. And I think one of the other questions I feel like we got a lot last year was like, do you prioritize geo preference versus program signal? And I don't know that we can 100% answer that. I think, a lot of us would probably say program signaling, and I think the data sort of skews that way. I don't know that it's like definitive, but if somebody just geo signaled you versus sent you a program signal, that probably means a little bit less, just because you have more options to send it to a program. But this kind of leads in, and I'll kind of do this as sort of a last kind of bucket of questions, and then I'm happy to stay on a few minutes late since we got started a little bit late, but are there anything else that you guys would recommend thinking about when you're trying to determine who to send program signals to? Like as a person, we've talked about a couple of them, but are there anything else out there that you would think through? Or think the student should think through? Nothing else. We've covered everything.
I was reading the chat. Can you repeat the question?
I was just saying, is there anything else we talked about a bunch of aspects of, how to determine or how to use your program signals. Is there anything else that we didn't mention that you think the students should consider or think through? Or
I think at the end of the day, make your decisions based on what's best for you. Yeah, it's getting more competitive by the year. But if geography matters to you, use those to your benefit. Use your signals wisely because it does matter at the end of the day. If somewhere you really want to be is, not in your signals, it doesn't make sense. But I guess one of the bigger things that I'll add, just because I don't know how many more of these I'll be on as we rotate through the topics, is if you're really interested in a place, keep in contact with them. Okay. The signal isn't it. You don't just get to like put a heart and signal and hope for the best. Really reach out and, keep in contact with them, especially if you don't rotate somewhere. Because it is just a giant game that ultimately, you've got to go through this algorithm and hopefully win. So I love hearing from people. I love hearing from people the whole season. So I know that the big stigma is don't reach out to programs, but if somebody's important to you and you want to know, something more, reach out to their program coordinator. Just put your name in their ear. And it may draw attention to an application they might have not, spent as much time on.
Could I ask a quick question on that?
Yeah.
My name's Hunter. Nice to meet y'all. Thank y'all for putting this on. So is it best to, reach out to PDs and PCs or, yeah, do y'all have a preference?
Everybody's a little different. I hear most of the time that PDs don't want to be, inundated with emails. I like getting them. Even if my PC responds, she keeps me CC'd on it. And, I've seen your name fly through. So, and she'll do the same. If I get to it first and I respond, then she, doesn't send a second thing. But I'm on the side of the coin that says it does not hurt to reach out. The worst that can happen is they don't respond, and then you get to feel like you're not loved back. But you're going to feel kind of that message a little bit all season. And then hopefully, it works out in the end. But I see no harm in being like, this is one of my front runners. If there's anything more I can do, let me know. I signaled you, I'm all in, because every year we get surprised by the end and we're like, oh, we thought we had that person. They played the game really well. But kudos to them, right? So you kind of have to put yourself out there like that. Because there are a lot more applicants every single year. And so if a place matters to you, you might reach out. Don't get weird, don't do it often. One time's pretty good. Unless you get a dialogue going or, some residents reach out, but I think one time's okay.
Yeah, I was going to say a similar thing, like, use your best judgment and don't be that creepy, crazy person that like you're just badgering, because then you're going to get blacklisted like real quick. But I think it's, I think for most of us, it's probably fine. Just don't be upset. Don't read too much into it if we don't respond, because I'll tell you, my email, as many of you on this call know, is a black hole. And like, depending on when you hit it, I may just miss it. And like, especially if I don't know the name it's coming from and it's not like, one of my residents or one of my, currently rotating students that I know is, there, then sometimes it just gets lost. So just don't read too much into it. But I think be respectful and, I think it'll be fine.
Thank y'all both.
Yeah, I would add to this that I think it's better to go through a more formal channel like the program coordinator or the chief resident than to try to reach out on social media, because not every program checks their social media frequently. So, your request could get lost. Not every program has, program directors running the social media, right? They could have like people hired from their parent medical school that run the social media and do the content. And so that person is not the best person to answer your question, right? And you wouldn't necessarily know to get your questions to the program director or the chief residents in the first place. So I wouldn't use social media as a way to reach out. I would honestly contact the program coordinator, program directors, or chief residents to try to find out more insight. And like everyone has mentioned already, if you don't get an immediate response back, please don't be alarmed and please don't be offended, right? This is the time of year that we start getting tons of emails. And when I say tons, I literally mean tons. right? And if we don't respond to you immediately, it's not because we don't care, and it's not because we're not interested. It's that we're also doing patient care. It's that we're also mentoring our residents. It's that we're also trying to get out at a reasonable hour to have dinner with our families. And it's not that we don't care about your email. It's just going to take us a while to get there. So, give us a little grace and don't expect an immediate response, and don't be hurt if you don't get a response within 24 hours. It'll come.
Yeah, absolutely. We don't always, it's not a perfect system and we don't always get back to everybody, but your name coming through has been charted at some point, whether by me or the PC, to be like, yeah, we've received contact from them. And that follows throughout our rank day. We'll keep, chart of what correspondence we've had and all that. So, like everybody said, just use your best judgment and don't get weird.
Then I'll just add, be genuine. Like, PM&R is not a massive field. And I still have some very vivid memories of people that, just flat out kind of lied and and sometimes we pick it up like during the process, and I think you can really kick yourself in the foot. So, don't go around telling everybody that you're their number one program, because you can only tell one person that, and be genuine. So just beware, be good people. So cool. Well, we are a couple minutes over already. So thank you again. I apologize for the delay in getting in. We don't exactly know what happened and why none of us could get in, but I just want to thank Amy from AAP as well. She is our go-to behind the scenes, does all of the coordinating of all of this. So thank you again, Amy. And then last but certainly not least, we have a few other webinars coming up. So don't hesitate to look on the AAP website for those schedules. And then there are transcripts of previous webinars from both like the first Road to Residency webinar with some questions in the chat. So typically within a couple weeks to a month after we have a webinar, we'll get the chat posted up there as well as the video to go along with it. Amy, am I missing anything else I should tell them that you can think of?
I don't think so. We do have fellowship webinars coming up also. Those will be starting soon. They're on the webinar page if people are interested in those. I know maybe a little early for some of you, but it might give you a little bit more in-depth into some of the specifics kind of thing. So
cool. Well, cool. With that, I will adjourn and say thank you, everybody. Thank you, panelists, for your participation and volunteering to do this. I always appreciate all the honesty. So thank you, thank you, thank you. Hope to see you everybody back for another webinar. Take care, guys.